things that you absolutely have to do when you're pregnant. When you're pregnant, like, you can't just live in a bubble. You can't move to Alaska and live underground in an igloo and not be exposed to.
I wanted to address the fact that whenever you look on a label, it always says, like, not intended for pregnancy or consult a physician. And if you have actually seen a label that says this is safe to use while you're pregnant, please let me know, because I've not been able to find one. So I got an overwhelming response from people about these wild stories of things they were told not to do or not to take while they were pregnant. And so this is going to have to be a multi-video series here. But the first thing we're going to talk about is one of the reasons why it's so difficult for healthcare professionals to confirm, yes, this is safe while pregnant.
Healthcare professionals feel more responsible for causing harm from something that they do as opposed to causing harm from something that they do not do. Like, for example, if they prescribe a medication and there is a bad result, like, they feel horrible, but there's not the direct connection if they don't prescribe something or don't do something and then there's a negative result. You get what I'm saying? So, like, they do something, like prescribe something or tell you to do something, and there is a bad result to the pregnancy, even if it's unrelated, they will feel horrible. But if it's something that they said not to do and then something bad happens, then there's not that direct connection. So, like, for example, not prescribing a medication and then the pregnancy, mom, baby has a bad result, there's not that direct connection. Whereas if they prescribe something and then something bad happened, then there is a direct correlation and then they feel bad. So, like, don't blame healthcare professionals. It has to do with the direct relationship. And a lot of doctors and nurses and therapists, healthcare workers, pharmacists feel that if they did something and it resulted in something bad, like, they feel horrible about it. So it's much easier to just say, like, hey, don't do it. Like, getting your hair done, like, oh, don't do it while you're pregnant. Or, like, well, actually, changing a litter box is a bad thing because of toxoplasmosis, so actually don't do that. But, like, other things like getting your nails done or, like, cleaning the floorboards. Actually, I'm going to say, if you're pregnant, don't clean the floorboards. But just examples are, if they say to do something and something bad happens, that direct connection, healthcare professionals just don't want to do bad things to you. Well, most of them. And they will feel more responsible if it's because they said to do something. But there are a limited few of us that are able to say, okay, you can do this. And say, for example, you're a company and, I don't know, you sell paint and you're not really sure if the paint, you know, in the baby's room, you paint the baby's room and then you pass out or something. Like, they just don't want that liability. They don't want that direct connection. So they're just uncomfortable with saying, this is safe during pregnancy.